So thanks for the opportunity to speak with you about the importance of research in respiratory care. Let me begin by saying that research is very important in respiratory care for a number of reasons. Importantly, perhaps number one, if we think of a profession is defined by not only a special body of knowledge, but also the generation of new knowledge that continues to move the field forward to solve problems that respiratory therapists and clinicians face every day. Respiratory therapy has had a long tradition of participating in scholarship and doing research that's caused the field to evolve from doing inhalation therapy, 50, 60 years ago only, to now being involved at the cutting edge of a variety of life-saving interventions. Mechanical ventilation, non-invasive ventilation, ECMO. Therapists are involved in the full spectrum of medical interventions, both in critical care and in non-ICU care, in pediatric care and adult care. So the field, as we know it today and as you're studying it today, is the product of a body of research that's been conducted by your predecessors as respiratory therapists in the field, often in collaboration with pulmonary docs and critical care docs, but nonetheless a very proud tradition of research. So the field itself depends on a line of research, of therapists that know how to do research, that are disciplined in the rigors of research, that know how to gather data, to think critically about hypothesis testing, hypothesis asking, writing, assembling data, displaying data in posters and presentations, and in peer-reviewed published manuscripts. So the most important reason for research is that the field depends on it. In the absence of research, respiratory therapy would be a vocation, like being an auto mechanic. There's not a lot of research being done in auto mechanics, but they're very well trained folks who can fix your transmission. And I would say that what differentiates respiratory care from auto mechanics or any other purely vocational field is in fact the body of knowledge that's evolving. So it's a requirement incumbent upon all of us, and particularly you as the next generation of respiratory therapists, to participate in that. That's the first reason. There are other reasons, however, that research is important. Perhaps most importantly, it helps solve problems in service of our clinical mission. So when we take care of patients, our goal collectively, for all of us, is to take the best care of patients that we can, to produce the best outcomes, to have them resume normal lives as full as possible. It's what we would all want when we're on the other side of the stethoscope or the scalpel or the IV. And for any of you who've had that personal experience or have had family members, as many of us have and all of us will eventually have, this is really important. So to be at the top of our game clinically requires a commitment to reading the literature, contributing to the literature, and bringing the best available knowledge to the bedside in service of our patients' well-being. So that's the second very important reason. The third important reason is that it's fun, and that the participation in gathering data, asking questions, getting answers to questions that haven't been known, and then sharing that knowledge with your colleagues at the AARC or the American College of Chest Physicians or the American Thoracic Society or the European Respiratory Society. All of these forums are forums in which colleagues assemble to share their knowledge, to share their work, and the outcome of a research project, if well done, is an opportunity to engage with thought leaders in the field and contribute knowledge in a way that's very fun and engaging. It introduces you to an intellectual climate of colleagues who are interested in engaging with you on your work and understanding your work, all of which requires, again, learning how to do this. This is a discrete body of knowledge doing research, just like setting up a ventilator, just like understanding the bronchopulmonary segmental anatomy, just like all of the things that are key to our clinical learning. So too is the discipline of doing research. We have to learn how to think critically, to ask critical questions that are answerable, to have the methodology to do so, to analyze the data, often using statistics, to display the data using clever graphic design, tabular displays, whatever format best lends itself to making a point. and then synthesizing the data in a written form, in a succinct, concise way, which is the way published papers appear because of peer review processes that require rigorous writing, rigorous data analysis, and at the end of the day, there's nothing more gratifying than seeing your name on a peer-reviewed published manuscript appearing in a high-impact journal, such as Respiratory Care, such as the American Journal of Respiratory Critical Care Medicine, such as CHEST, such as many other high-impact journals, JAMA, the New England Journal of Medicine, all of these things. Your colleagues will, of course, recognize the contributions you've made, will acknowledge that. That, too, is gratifying, and it advances the field. So, again, 3 reasons that I think research is very important and why, as you embark on this course, mastering this and translating it into your own practice, I think, are very important. 1 is it's key to the definition of the profession. 2, again, it's key to providing our patients the best care that we can provide, bringing science to the bedside. And 3, because it's very professionally gratifying to all of us as individuals who contribute to research. So good luck in your course. I will follow with interest. Thanks very much.